Hello all, I am Dr. Archana Daftardar, consultant nephrologist at Renova Hospital, Kompally. So we will see what are the types of kidney biopsy. So there is something called as percutaneous kidney biopsy, and the second one is the open kidney biopsy. Percutaneous means through the skin which is done, which is commonly, that is what is the procedure we do when the patient is admitted. And open biopsy is like opening the thing and then taking the biopsy of this, which is rarely done, particularly in cases of tumors it is done. So these are the types. Now we will see what is the risk involved with the kidney biopsy. Whenever we are pricking any organ or any skin in the body, there is a chance of bleeding. So bleeding is the major risk factor for the kidney biopsy. So usually patients who are having risk factors for kidney bleeding will have more risk of bleeding during the procedure. So what are the absolute contraindications? Suppose the patient has a bleeding disorder, then it becomes a complete contraindication for the kidney biopsy. We cannot do it. As well as patients on some medications which is making the blood thin, then we have to weigh the benefit and the risk for that particular patient about this procedure, and then it has to be decided. Patients having single kidney is also becomes a relative contraindication, because with one kidney we cannot put the patient at risk for the biopsy. So these are certain absolute contraindications. Also, if the patient is not cooperative, then also the procedure cannot be done. So these are the contraindications. So as I said, the bleeding is the major complication in this biopsy procedure. When we prepare the patient, how to prevent this complications, we will see that. Proper BP control, absolute BP control helps in controlling the bleeding from the kidney after biopsy. So BP control is most important. Confirming that the patient has a normal platelet count, normal bleeding parameters will also help in preventing the bleeding complications. Also, patients who are on certain drugs, we will have to see and stop it before the biopsy. So these are certain indications and the contraindications, risks, and the prevention of this. Now let us see how the biopsy is done. So usually it is a one-day hospital admission procedure. So it is always advisable to admit the patient for 24 hours and then do this procedure, because once the procedure is done, patient needs to be under observation to watch for this bleeding. So a patient is admitted with pre-evaluation, pre-procedure evaluation. After confirming that the patient is fit for the procedure, patient is admitted, and patient need not to be nil by mouth completely, but at least 2 hours NBM is nil by mouth is enough, fasting is enough. Patient is asked to lie on a prone position, that is the stomach facing down, and from the back side where the kidneys are located, with the help of the ultrasound, the kidneys are located, and usually from the left side of the kidney, lower pole. There is in the anatomy there is some upper part and the lower part of the kidney. So usually the piece is taken from the lower part of the kidney in the prone position. First we give the local anesthesia. Small injection is given to make the area anesthetized. Then with a gun, there is a small tip of the gun which goes inside, and then it collects the small piece of the kidney. Once such 2 or 3 pieces are collected, then the tight dressing is given, and these samples are sent for the histopathology for light microscopy, immunofluorescence, and electron microscopy if needed. Then the tight dressing is given, patient is made into supine position, and patient has to be bedridden at least for next 18 hours, 12 to 18 hours. So that there is no jerky movement, there is the chances of bleeding are minimized by taking this precaution. Then patient is asked to void in the bed itself, and we watch for the hematuria. It is the urine sample is collected in a serial manner in the bottle to watch for hematuria. Slight blood in the urine is expected when we do the biopsy, but eventually the urine gets cleared off. So the hydration is an important aspect of this biopsy procedure. Depending on the patient's volume status, patient's fluid status, the doctor will be advising about the fluids. For there may be slight pain which can be tackled with mild analgesics, and Next day morning, usually we discharge the patient, and the patient is asked patient is advised to avoid lifting heavy weight for next 10 to 2 weeks. So this is what is the procedure is. Apart from bleeding, there is no much risk, but the bleeding risk is the important risk which needs to be explained to the patient. Patients who are having high creatinine level will be having more risk of bleeding. So patient having diabetes will also be having more risk of bleeding. So these are certain precautions which the doctors or your nephrologist will definitely take, and then we can go ahead with the procedure. So I hope you understood about the kidney biopsy, and whenever your doctor advises or the advises for the kidney biopsy, do consider it, because it gives lot of information about your disease and about the further course of the disease. Thank you very much.